ॲक्युरेट आहेत नंतर मार्केटमध्ये.
हम्म.
सगळे ॲक्युरेट वॉच सगळे हार्ट वगैरे हे झालं.
हे सगळं वाचतो का आपलं ऐकतो?
किती झालं 97.
असं भारीच असतं.
Hello everyone. Very good afternoon. I am Dr. Harshita Gagrani. Welcome all of you to the ADC inclusion. I welcome dentists from Malaysia as well as dentists as members of ADC Inclusion Academy of Dental Careers from 2017. Today's webinar is ADC webinar 175 to be presented by respective speaker Dr. Ashvini Vadane on topic post-operative management of transalveolar extractions. I request Dr. Sakshi Ahuja to introduce today's speaker. Dr. Sakshi, are you there?
Yeah. Okay. Okay. Hello, good afternoon, all. This is Dr. Sakshi. Welcome you all to the ADC 175th webinar. As we all encounter post-extraction complications often in a practice, today Dr. Ashvini Vadane would be sharing her valuable experience in managing these post-extraction complications. To know her, ladies and gentlemen, she has pursued her MDS from MA Rangoonwala College of Dental Science and Research Center. And she is also a practicing consultant in Thane, Mumbai, and is the owner of Arunika Oral Surgery and Dental Clinic in Pune. She has more than 35 national and international publications and has also won many awards, one of them being the Global Outreach Dental Award in 2022. So let's welcome all. And welcome to you, very warm welcome to you, ma'am. Over to you, Dr. Ashwini. Yes, Dr. Ashwini, are you there? She's not there.
Hello, good afternoon. Good afternoon, everyone. Am I audible?
Yes, you are audible. Yes, ma'am. You can start it.
Okay. So, sorry for inconvenience. There was a network problem.
No issues, no issues. Please go ahead.
Yes. Just give me a few seconds. I will share my PPT.
Take your time, ma'am. Adjust everything. Take your time. No problem. We are all
Yes.
waiting.
Thank you. Thank you, sir.
सगळ्यांचा डाळ भात
Uh, is my screen visible?
Yes, your screen is visible now.
Okay. So, good afternoon, everyone. And really sorry for the inconvenience. It was due to network issue. So, I am Dr. Ashvini Vadane. I'm oral and maxillofacial surgeon by profession. I have worked as an
Voice is
associate
little less.
professor.
You're audible.
Sorry.
Voice is there, but little less. Can you please increase?
Uh, now is it fine?
Yeah, okay.
Okay. So I work as an associate professor at one of the renowned dental colleges, and I'm PG
प्राइवेट
guide
प्रैक्टिस
also.
फादर मुरादाबाद में फिजिशियन और इसने
Hello.
खुद मुझे लग रहा है
Sorry. Yes. So today we will be talking on management of complications post transalveolar extractions. This is very routine thing what we encounter in our dental practice. But usually transalveolar extractions are done by oral surgeons. But many times general dentists also attempt, and sometimes anyone can land up in complications. So as a dentist, we should know how to manage these complications, and it's a very important topic as far as dentistry is concerned. So today will be the overview on the management of complications post transalveolar extractions. Transalveolar extractions, in simple terms, it is the surgical extractions. So contents of today's topics are, first of all, we will see the introduction, then types of extraction, uh, and then post transalveolar extraction complications and their management. So this is how I have briefed this topic in three simple points: introduction, types of extraction, and complication. That's it. So it's very easy to understand. It's very basic topic. So dental extractions, these are the routine dental treatments what we encounter in our dental clinics. And for dental extractions, we should be aware of all types of dental extraction, forceps, elevators, then luxators, whatever instruments we need for the extractions. It is very must thing that every dentist should be thorough to avoid the complications, or I can say to minimize the complications. And I hope all of us know that, and we teach the students in that way only, that they should be, first of all, they should know the basics. What are the forceps, which is the ideal forceps to extract which tooth, what are the types of elevator, principles of elevators, how to use elevators. So all these things we should know, as these are the routine dental treatments. And what is exodontia? Exodontia means removal of tooth in simple term. So exodontia or tooth extraction is defined as the painless removal of the whole tooth or tooth root with minimal trauma to the investing tissues, so that bone heals uneventfully and there will be no any post-operative prosthetic problem is created. So that this is the simple definition, but thing is that it covers everything. So whatever extraction we are going to perform, first of all, it should be painless. So painless is not the proper term. It should be, I can say, with the minimal pain possible. So for that, first of all, you can use the topical local anesthesia followed by the local anesthetic injection, so that the injection will be less painful. And then we will attempt for the extraction. And as I told, we have to use the proper instrument, whatever is ideal for that tooth. And there should be minimal trauma to the investing tissues. Whatever tissue is surrounding to that tooth, we should cause the less trauma to that, as less as possible trauma to that tissue, so that if we cause the less trauma, the healing will be faster. Okay, that may be soft tissue healing or bone healing, any type of healing will be faster if we cause the less trauma, and there will be no any complications. Okay, that's our today's topic, management of complications. And the exodontia के aim में we also include, there should be no any post-operative prosthetic problem is created. So whatever patients come for extraction to us, then in future they go for the prosthetic rehabilitation. So while doing the extraction, we should take care that there should not be any post-operative prosthetic problem. So that is the aim of the exodontia or extraction procedures what we perform. Then further point is types of extraction. Types of extraction, there are two types of extraction: intraalveolar extractions and open extractions. Can anybody define or tell me what are the intraalveolar extractions? Hello? Hello?
Yes, ma'am.
Yes. Can anybody define or tell me what are the intraalveolar extractions?
Yeah, please.
Today's
Good
topic.
afternoon, ma'am.
Everyone can answer.
Yes.
Ma'am, intraalveolar extraction are those extraction in which no surgical cutting of the bone is involved, and the tooth is only removed out of the socket without using any surgical method.
Right. So that is the intraalveolar, and iska exactly opposite is the transalveolar. Okay, that is the surgical. So intraalveolar extractions are the routine extractions what we perform with the forceps. Okay, so we administer the local anesthesia. For that, first of all we should know the knowledge about the local anesthetic techniques. That is the different topic. Okay, in what type of block we should administer, when the local infiltration is necessary. Sometimes intrapulpal injection is also necessary. So all that is the basic knowledge, and that's the different topic that I won't cover today. But first of all, you have to give the local anesthesia, followed by then you will check for the objective and subjective symptoms. Okay. Objective symptoms that you will check with the Moon's probe, and for subjective symptoms you will ask the patient whether he is having pain or not. And then along with the forceps, appropriate forceps, you will perform the extraction. That is the intraalveolar extraction, which is also known as the closed extractions. Closed extractions because we are not opening the surrounding tissue. That's why it is known as the closed extraction, or conventional extraction, or forceps extractions, because we are performing those with the forceps. And iska exactly opposites are the open extractions, or surgical extractions, or transalveolar extractions, because in this we are going to perform the surgical procedure. Okay, so can anybody explain me what is the procedure for the surgical extractions? You can attempt, I will modify it. I know everyone is not oral surgeon. Yes.
तो इथला मित्र कोणाचा
नाही जशी
हा मग त्यांनी
Hello.
फोन आला, त्यांनी फोन लावला होता की मी आहे इथल्यावर असतो. ठीक आहे, मग ये इकडे माझं.
Yes, can anybody explain the what is the procedure for the surgical extractions? Hello.
It is for normal tooth or third molar or any.
Any tooth. If you are going to perform surgical extraction, what will be the first process?
There
See,
is
first of all,
difference-
those dono use
Yeah.
yes, explain please.
There is difference between closed extraction and surgical extraction. That is, we separate more gingiva, then we give incision also, and we open the flap, and we get access to the bone also, so that visibility is more. And then we, if required, we will do sectioning of the tooth if required, if it is submerged or
Okay.
if it is ankylosed. That is surgical extraction,
Right.
or open extraction.
Right.
And closed
Right.
extraction is we just separate the gingiva with Moon's probe and remove the tooth with forceps or elevator without
Okay.
incision.
Yes. So, yes, whatever you have told, it is right, or I will say it is partially right.
Okay.
Because thing is that आपने you explained the extraction का procedure very well, but what after that? एक बार दांत निकल गया, उसके बाद what will you do in the surgical extraction?
Then suturing is compulsory, mandatory in open extraction, and closing
Yeah.
the gingiva properly so that healing will be there and bone formation will be there. Otherwise, bone formation will not be there. And
Yes,
traumatic
that
extraction
is right.
can be there.
Yes, that is right. But before the suturing also, we have to perform the proper curettage.
Curettage,
And
yeah.
yes, and then betadine irrigation. And
Okay.
if there are bony irregularities, we have to smoothen those irregularities.
Yeah. Okay.
And this is known as the toileting of the socket. And it's very much important. Many dentists forget it, and it will land up in the complications.
Yeah. Okay.
Okay. So basically, whatever today's our topic is the management of complications. So first of all, it's not like that management will start after the complication happen. We have to take the precautions पहले से ही, prior to extractions से. So that's why in open extractions, the toileting of the socket, curettage, then bone filing, proper suturing, all these things are also important. Okay, so that's why I wanted to explain the difference amongst these and how to handle the open extractions and closed extractions, so that there will be minimal complications. So as I told, for this, first of all, we should be very much thorough about our knowledge about the local anesthesia, then local anesthetic techniques, Then exodontia instruments. In that, forceps, elevators, and luxators are included. And third is the suturing. In that also, what type of suture should be given in what case? That is also particularly important. Many of us means many of the general dentists, they don't know कि कौन से time पे कौन सा suturing type देना है. Okay, so that is also we have to read from the oral surgery textbooks. Types of suture, types of suture materials, then types of suturing. All these things we should be thorough with. Then only we won't land up in the complications. So this was the motto for explaining all these things. So post transalveolar extraction complications and their management. The first very common complication is the hemorrhage. That is the bleeding from the socket. Many times after extraction also bleeding doesn't stop, and many times patient complain कि खून आ रहा है, बार-बार खून आ रहा है. Can anybody guess what can be the reasons for this complication, hemorrhage?
If patient is on blood thinners, then
Right.
diabetes,
Okay.
traumatic extraction, excessive forces, wrong
Right.
placement of the instruments, and trauma to the tissues.
Okay. So yeah, see, if patient is on blood thinners, diabetic, all these things come in the case history. So prior to extraction only, we have to check that patient should not be on blood thinners. If he is on blood thinners, then there is the protocol that we should stop those blood thinners 3 to 5 days prior. And then if the blood pressure is in the normal range, then only we perform the extraction. So blood thinners भी है, but if we don't take the proper case history. And in case of diabetes, yes,
Loss of blood clot from the socket.
loss of blood clot from the socket, that's the reason. And that usually happens when the patient spits immediately after the extraction. Okay, so that's why in the instructions we have to mention कि patient do not spit for at least 24 hours, so that there won't be the dislodgement of the healing clot, and there won't be any hemorrhage. That is the one reason how we will avoid this. Okay, so second complication is the swelling. Specifically in the surgical extractions, many times there is the post-operative swelling on the second or third day. What can be reason for this?
Actually, swelling is good for the patient. It is the
Yes.
reaction of the body for healing
Right,
purpose.
it is the inflammatory response, right?
Inflammatory response, yeah. But
Right,
if
right.
traumatic extraction is there or wrong placement of instruments and all,
Yes.
and
So, yes. Yes, many
non-required
times due
tissue
to,
is cut that time.
yes, many times due to trauma or infection, there will be swelling. That is not good. Okay. So that is the complication. We are going to see how to manage all these complications. Then the third one is the hematoma or ecchymosis. This is also many times seen post transalveolar extractions. Hematoma usually we also see after the this thing posterior superior alveolar nerve block. Probably most of us have encountered this. Has anybody experience of this after PSA nerve block? Hello?
No, ma'am, not yet.
Okay, fine. Okay, no problem. So it happens if there is the injury to the pterygoid plexus, which is we encounter while giving the PSA nerve block, there is the possibility of hematoma. no issues. Then next complication is the trauma. Okay, we have discussed already that if suppose we perform the traumatic extraction, there will be the trauma to the soft tissues and it will postpone the healing, and that is the complications. Then comes the trismus. Trismus is the limited mouth opening or inability to open the mouth. Many times after performing the extractions, usually mandibular molar ka extraction, patient comes to us that there is the inability to open the mouth. So, can anybody guess why it happens? It's very simple. If there is the injury to the medial pterygoid muscle, there will be the limited mouth opening. And this can happen while giving the inferior alveolar nerve block, and it leads to the trismus. The next complication is the dislocation of the temporomandibular joint. Okay, if we perform, apply the excessive force while performing the extraction, there is the possibility there can be the dislocation of the temporomandibular joint. Many times this complication happens and they give us call कि ऐसे हो गया, dislocate हो गया है, and the oral surgeon will come and properly guide the TMJ in the proper position. In that way, we can manage this complication. The next complication is the sharp bony irregularities. As shown in the diagram, you can see whenever we perform the extraction, if we are performing it surgically, or suppose we have performed it with thoda bahut trauma, then it's our duty to smoothen all the sharp bony irregularities, because otherwise it will go for the alveoloplasty and it will be the another surgical procedure. So it's better to file those while doing them after the extraction only, so that we can avoid patient ka another surgery, as well as in same local anesthesia we can wind up with the 2 surgeries. So that's why we should always make sure there should not be any sharp bony irregularities, so that it will be good for the patient to go for the prosthesis also, as well as there won't be any trauma to the other soft tissues in the oral cavity. So this is how we will manage the sharp bony irregularities. The next complication is delayed healing of wound. Delayed healing of wound usually occurs in the diabetic patients, or if a patient is having some blood disorders. In those conditions, it is possible. So that is also the complication. Then next complication is the orohantral fistula. Okay. So orohantral fistula, can anybody tell what is the orohantral fistula? Many times if we
Orohantral
perform
fistula is an opening that is caused, one of the complications, because it is caused because of the a bit of traumatic extraction, and it's an opening between the oral cavity and the sinus.
Right. So whenever we perform any traumatic extraction in the upper arch, specifically with the upper molars, at that time there is the possible there will be communication between the oral cavity and the maxillary sinus, and it lead to the oroantral fistula. So this is also one of the major complication, and it can lead to sinusitis also, as well as patient will feel discomfort. So we have to treat this surgically. So better to avoid this. So how to avoid it? That after performing, if हमें समझ में आ गया कि there is the traumatic extraction, or there is the समझ में आ जाता है immediately after the extraction, we come to know with the mirror test whether there is the oroantral communication. If we feel there is the communication, So it's better to suture it at that same time. We have to give the watertight sutures so that there won't be oroentral fistula. In this way, we are going to manage the oroentral fistula. The next complication is the acute osteomyelitis of the mandible. Acute osteomyelitis of mandible, acute osteomyelitis of the mandible is the condition which it happens if there is the prolonged infection in the oral cavity. And in that condition, if we perform the extractions, it will lead to the osteomyelitis. Osteomyelitis itself is a very vast topic. So if you want to avoid the osteomyelitis, the basic precaution we should take that there should not be any infection in the oral cavity while performing the extraction. Now, how to rule out this? See, it's a very basic protocol that we can follow to avoid such kind of things. Whenever you are going to start any extraction case, first of all, irrigate it with the betadine solution. It's very easy. Take the betadine in the syringe, irrigate the whole oral cavity, and then apply the topical anesthetic followed by the local anesthesia injection. Okay, so this is how we can follow the aseptic protocols. And sterilization and asepsis is very much important in oral surgery. Not only in oral surgeries, in entire dentistry it is very important because unsterile things can land up with the most of the complications. So it's our duty to check whether in our clinics, hospital, sterilization अच्छे से हो रहा है कि नहीं. Okay, because this can lead to the life-threatening conditions also. Next is the aphthous ulcer. Aphthous ulcer, usually it happens if there is the traumatic extraction is there and bony irregularities remained. And due to the constant trauma, aphthous ulcer, it can happens. Specifically in this diagram, they have shown the aphthous ulcer related to the lower lip. ये कब होता है usually when you are performing the surgical extractions. While performing the surgical extraction with lower third molar, at that time you have to use the handpiece. And with that constant handpiece ka irritation and touch, and there is the thermal energy which produced through that handpiece, it creates the aphthous ulcer over that lower lip. And it commonly happens. In those cases, you can immediately, जब भी हो गया surgical extraction, you can tell the patient, you can prescribe the patient the mucopain gel to apply on the lower lips so that we can avoid the further complication. Next is the osteoradionecrosis. Osteoradionecrosis is very severe condition which happens usually after the osteomyelitis. And as I told, if we maintain the proper sterilization protocols, proper aseptic protocols, and if we avoid the presence of infections in the oral cavity while performing the extractions, it won't land up in such a severe complications. This is how we can avoid it. Then the next complication is the surgical emphysema. Surgical emphysema, it happens in the surgical extractions due to the constant use of the surgical handpiece. There can be the air entrapment in the tissues and that lead to the surgical emphysema. But fortunately, it subsides by itself. Just you have to assure the patient that there is no anything to worry. So now we will see all these complications one by one. So first is the hemorrhage. We already discussed that first and foremost thing is to take the proper case history. We should be aware of all the blood disorders patient is having so that if any mandatory treatment is necessary, we can send the patient to the physician to consult. Like we have to ask about the hypertension, diabetes, thyroid disorders, Then is there any history of blood transfusion, asthma? All these things are very important. And if any of these is not in the proper range, then it's our duty to send that patient for the physician's consent. So that's why the thorough case history is very much important. Then perioperative measures.
Excuse me, ma'am.
Okay. Yes.
This meeting will get ended and we will